Alicia Cameron here, student ID T007477100. Here to talk to some of my coworkers, cute coworkers. Hi.
Hello.
To my live audience about FIP. Okay, so I have chosen to present my major project on the topic of feline infectious peritonitis, otherwise known as FIP. FIP is an important topic in immunology because it's the most common infectious disease in cats, especially in shelters or multi-cat environments. It can be difficult to diagnose, and then up until recently had a 100% fatality rate. Okay. So we'll start off by talking about the basics of FIP. What is FIP? So just over here. FIP is a mutated form of feline coronavirus. Feline coronavirus is a relatively harmless infection with little to no clinical signs. However, it is highly contagious and extremely prevalent in those multi-cat environments. So much so that up to 90% of cats in multi-cat environments will become infected with it, and 50% in single cat environments will become infected. And then of those infected, up to 5% of those will develop FIP at some point. It is transmitted by fomites or by the fecal oral route, which is why it's so prevalent in multi-cat environments. Coronavirus spontaneously mutates and then develops into the much more harmful FIP. It replicates and then spreads in the monocytes and macrophages throughout the body. It's more likely to affect cats under 2 years of age, those under 10 years of age, and then those that are also immunocompromised. And males and purebred cats may also be predisposed to developing FIP. Okay, so what are the symptoms of FIP? So when coronavirus develops into FIP, cats may show initial signs of lethargy, inappetence, weight loss, and have a fever. There are two forms that they may develop. They may develop either one or a combination of the two. There is the effusive or wet form, and then the non-effusive or dry form. And the type is based on whether or not effusion develops in the patient. So most cats develop the wet form, just right here, meaning that fluid accumulates in the abdominal or thoracic cavities. This accumulation of fluid results in a distended abdomen or the pot-bellied abdomen, shown right here by this cat with FIP. And when the fluid accumulates in the thoracic cavity, they may also have difficulty breathing. So there's so much fluid pushing on their lungs. And those with the dry form develop severe inflammation in one or more of their organs, such as the kidneys, liver, intestines, abdominal lymph nodes, and the eyes. This can result in neurological symptoms such as ataxia, tremors, or seizures, but the ocular abnormalities are the most common symptom reported. So just over here we have a cat with uveitis caused by FIP. Okay, how do we diagnose FIP? Okay, so diagnosing FIP can actually be quite difficult. There's no definitive test that can rule out or confirm the disease. Many tests are supportive of FIP, but not actually diagnostic. Presumptive diagnosis is made based on signalment, clinical signs, pathological finding, and physical exam. In the case of those with the wet form, fluid samples can be obtained by abdominocentesis or thoracocentesis and then sent off for analysis. The fluid, typical of FIP, is straw, kind of yellow colored right here. And then upon analysis, we'll have high protein and leukocyte levels. Just down here is actually what a cytology will look like, so it's full of white blood cells. Blood work can show elevated globulin levels and decreased albumin levels, which therefore creates a decreased albumin to globulin ratio. Kidney and liver values may also be increased, which is indicative of damage to those organs. Antibody testing is available, but it's unable to distinguish between FIP strains and non-FIP strains of coronavirus. And then just up here is a radiograph of a cat with a bunch of abdominal fluid. And then there's the abdominocentesis to obtain the fluid. The gold standard for testing FIP is surgical biopsies sent off for immunohistochemistry. The virus spreads throughout the macrophages, and then they infect organs which don't usually contain large numbers of those cells. Obtaining surgical biopsies is the best way to diagnose. Again, it cannot differentiate between the strains, but it is highly indicative of FIP. And confirming antigens in these macrophages is what indicates that it's FIP. Since those infected with FIP are usually quite sick, surgery isn't usually an option, so biopsies are usually done post-mortem. Okay, so where are we? How is FIP treated? Just in here. Okay, so for many years, FIP was actually untreatable and always fatal. All you could do was manage quality of life and supportive treatments, or with supportive treatments. In 2021, GS 441524, which I'm just going to call GS for short, because I won't remember that number. So GS was legalized in 2021 for treatment of FIP, but only in Australia and the UK. In February 2024, the antiviral medication, GS, became legally available for shipment to Canada, so we were able to treat here. Before this, owners were acquiring drugs through the black market, purchasing through Facebook groups or online, buying in back alleys, and then treating at home. So to import the GS to Canada, an emergency drug release had to be requested, and this process took roughly 7 to 10 days between the requesting, the approval, the ordering, and the shipment. So obviously this timeline for some meant life or death for critical patients. It also could only be ordered by a case-by-case basis, so vets weren't able to stock up for future patients. GS, however, is now available for shipment within Canada. There's Trutina Pharmacy, which is based in Ontario, is the only pharmacy in Canada producing and shipping. So having it available drastically lowers the time to treat patients. I think it takes only a day or two to receive it. The treatment goes for a minimum of 12 weeks and costs roughly $3,000. I couldn't find any recent prices since it started shipping in Canada, so that might be a year old, but that's all I could find. Obviously during the course of treatments, regular checkups are recommended. And then even though treatment is pricey, what used to have a 100% fatality rate now has an 85% survival rate. Yeah. Is there a vaccine for FIP? A vaccine for FIP is available, however, it's not recommended by AHA. It is safe, but the efficacy is still in question. Most cats actually become infected with coronavirus prior to when the vaccine is able to be administered, so it kind of defeats the purpose. And because this vaccine doesn't have enough evidence to support preventing FIP, it does not outweigh the risks of giving it. Or benefits do not outweigh the risks of giving it. Okay, so precautions that should be taken in the vet clinic. So coronavirus is actually the infectious part of FIP. It's not necessarily FIP itself. Small amounts of FIP the virus FIP are shed in the feces, but it is less transmissible than coronavirus. But it's still recommended to take precautions in the vet clinic to prevent the spread of coronavirus to other cats, and then in turn preventing the spread of FIP. So if treating a patient in hospital, isolation is recommended, but if unable to isolate, then barrier nursing at minimum should be done. Proper PPE includes disposable gown and gloves, and then disposable booties if you're walking in their pen or enclosure. But with a cat, I feel like that's not really necessary, so usually just in a kennel. Any nursing equipment used should be used on that patient only. And then the use of disposable bedding, litter boxes, and dishes is also recommended, but once again in a vet clinic, not the most practical choice. So these items can be soaked in Prevail for 5 minutes and then washed and rinsed just as regular. Any countertops or surfaces should be disinfected with 1 to 40 Prevail concentrate with a contact time of 5 minutes to ensure complete disinfection. Okay. Any precautions that can be taken at home? While it's impossible to know if the virus is going to mutate into FIP, there are some simple precautions to be taken at home to help prevent it. Ensure all litter boxes are cleaned, not only regularly, but regularly with bleach as well. And then obviously keep your food and water dishes away from the litter boxes just to prevent possible contamination or ingestion of fecal material. And then high stress levels can also be an additional risk for FIP, so just keeping your stress levels low at home, and then just a good, healthy, clean living environment for the cat also helps. Okay, so in conclusion, FIP is a deadly disease affecting many felines worldwide. There is limited treatment options, unfortunately, but new research and advancements are continuously being made. In the last 5 years, we've made great progress, developing a treatment. So we can only hope that in the next 5 years, there is many more advancements to come. That's all.